Good morning, everyone. Thank you for being here at the SIH Cancer Institute in Carterville, and for those of you who are viewing from the live broadcast. I'm John Antese, President and CEO of Carbondale-based Southern Illinois Healthcare, a comprehensive healthcare system of 4 hospitals, 650 employed and affiliated providers that practice across 65 different specialties and subspecialties. SIH not only provides the region's only comprehensive care cancer center, but they also are the region's only birthing center, only special care nursery, the only dedicated pediatric unit, the only level 2 trauma center, and the only open heart program. We're here to celebrate an announcement from the Illinois Governor, J.B. Pritzker, related to the $20 million, 20,000 square foot expansion of the SIH Cancer Institute, an expansion completed just 7 years after we opened our doors. In the spring of 2015, we were averaging 100 patients a day coming through this cancer center. Today, more than 300 patients come here every day for care. Ahead of the announcement from Governor Pritzker, I would like to thank the following individuals who are with us today. Senator Dale Fowler, who you will hear more from later, Representative Paul Jacobs, Michelle Cerruti, and Darrell Hampston from the Illinois Department of Commerce and Opportunity, representatives from the Illinois Comptroller Susan Mendoza's office and the offices of U.S. Senators Dick Durbin and Tammy Duckworth, Carterville Mayor Brad Robinson, Carbondale Mayor Carolyn Harvey, the Heron Mayor Steve Fertini, and the Murfreesboro Mayor Will Stevens. I'd also like to offer a special acknowledgement to the late Eddie Smith, a longtime leader of the Labor's Local 773 and Chair and CEO of ULICO. Eddie was fully engaged with Governor Pritzker and his staff in support of the SIH Cancer Institute expansion, and he's here represented by Brandy Bradley today. There are many other people who were instrumental in helping to bring this expansion to the SIH Cancer Institute that couldn't be here today. So we're not going to, for the sake of time, we're not going to mention everybody, but I do want to mention and not be remiss in mentioning the Senate President Harmon, the Senate Minority Leader McCondies, and current House Speaker Welch. They were all instrumental in helping support us. Your other guest speakers for today, in addition to Governor Pritzker and Senator Fowler, will be the SIH Cancer Institute Medical Director, Dr. Mohammed Papazai, one of our patients, Lori Merrill Fink of Carbondale, the SIH Oncology Service Line Leader, Susie O'Neill, and SIH Chief Development Officer, Woody Thorne. We live in a community that is very closely interconnected. Together, we rise and together we fall. Over the past decades, communities like ours across rural America have been faced with many, many challenges. One of the challenges for communities in rural America is something we call being medically underserved. That simply means that there's a lack of access to medical services compared to other communities across the United States. Communities with limited access to medical services across the country aren't just located in rural areas. They're also communities within large urban centers. On the surface, these two types of communities don't appear to have a lot in common. However, they share many of the similar challenges. Challenges such as higher rates of poverty, higher rates of unemployment, the need for good jobs, high rates of food insecurity, as well as high rates of people who get their insurance either through government means like Medicare and Medicaid or are uninsured. Not having access to quality medical care, good jobs, and food are basic needs that our legislative leaders from both rural and urban areas can and do find common ground to work across the aisle. In Southern Illinois, poverty rates across our community is 50% greater than the Illinois average. The unemployment rate is 25% greater than the Illinois average. 1 in every 4 households in Southern Illinois has a family income of less than $25,000 a year. And 3 out of every 4 persons in our community is either covered for medical insurance under government-funded insurance, or they have no insurance. When you combine these underlying societal factors that lead to limited access and the impact of the severe national shortage of healthcare professionals, along with the rapid development of new complex and costly medical treatments, you begin to see underserved communities that turn into what we call medical deserts, as local hospitals choose to close services or close altogether. At SIH, as the largest private employer in Southern Illinois, we are committed to this community. SIH Missions calls us to provide high-quality care that everyone in our community can access. This is our home, to whom we are 100% committed. That's why we provided more than $1 billion of charity, uncompensated care, and community benefit over the last 10 years. The SIH Cancer Institute is a shining example of SIH's commitment to the people we serve. With historical incident rates of cancer and mortality rates well above those for Illinois in the U.S., we saw a need. We saw a need for greater access to high-quality, comprehensive, multidisciplinary cancer care in our community. There was a need to ensure that our neighbors, that our loved ones, did not have to travel 100 miles plus just to receive the current state-of-the-art care for cancer. Through the work and support of many people, the Institute took flight a little over a decade ago and has soared ever higher since. The demand has been such that we had to expand services 7 years following the original opening. Today, while the incident rates of cancer in Southern Illinois are still higher than the averages across Illinois and the U.S., the mortality rates are declining at a rate that is faster than the decline in overall Illinois and the U.S. What does that mean? That means our neighbors, our friends, our loved ones, there are more of them with us today than would have been if we didn't have the SIH Cancer Institute. So it's my profound pleasure to introduce the governor of the great state of Illinois, J.B. Pritzker.
Thank you, John. Appreciate it. Well, thank you very much, John. Thanks to all of you who are here today, and it is really a pleasure to be back here at SIH Cancer Institute. I got my first taste of this place with a tour by Rex Buddy, who gave me a sense of enthusiasm for what we needed to do to lift up this institution. It was already a center of excellence in Southern Illinois, and for so many people who've been treated here. But it's something that I think when you're trying to think about what to, as governor of Illinois, what your responsibilities are, lifting up an institution like this is among the most important things that we could do. And I'm very, very pleased and proud to be here today to make an announcement and to support the work that's being done for so many people across this region. I know that lots of people behind me have already been recognized. I want to add to that recognition a friend whose book I just dove into over the holiday, and that's our great former congressperson, Glenn Pichard. Thank you very much for your leadership, Glenn. And of course, there are so many other, you've mentioned some mayors that are here. I want to mention Jerry Womack, who, from the Laborers 773, and of course, I'll say a few words at the end about Ed Smith, but he too, one of the great champions of this institution and this entire region. So good morning to everybody, and again, pleased to be here. I want to, make special mention also of someone who's going to speak in a few minutes, who's a cancer, well, she would call herself not a cancer survivor, but a thriver, and that's Lori Merrill Fink. So you're going to hear a few words from somebody who has been so positively impacted by this place, and I can't wait to hear what she has to say. So When this facility opened in 2015, the SIH Cancer Institute became the region's first dedicated cancer treatment center. And as I said before, it's a center of excellence. It isn't just a place where people get treated. This is a place that people aim for when they want to get treatment for cancer because of the success rate that it has. And although administrators and providers prepared for a significant volume of patients, the demand far outweighed the original 43,500 square feet of a building that was built here. So the SIH Cancer Institute team immediately got to work planning a 20,000-foot extension just 3 years after opening its doors originally. 8 new exam rooms, 9 more physician offices, another 2 consultation rooms, a larger waiting room, a new on-site blood bank, 22 more infusion stations, more public restrooms, nursing stations, parking spots, registration carols, and draw stations, and the region's first USP 800 state-of-the-art pharmacy on top of an advanced image-guided radiation therapy system called the TrueBeam STX, which is designed to treat some of the most complex cases of cancer. Every day, SIH Cancer Institute has been serving 300 patients now. And now, after all of the years of planning and design and construction, it has the opportunity to provide modernized healing spaces and quality holistic care that people deserve. Everyone that walks through this door gets in order to prepare themselves to beat cancer. As governor, there's no more important thing that I can do than to improve the health and safety of Illinoisans, no matter their zip code, no matter their income status. And that means eliminating rural health disparities, expanding preventative care, improving quality of life, providing affordable, accessible treatment for every Illinoisan. SIH Cancer Institute is the embodiment and realization of these goals. It's for that reason and many others that I couldn't be prouder to announce that we are awarding the SIH Cancer Institute $10 million in Rebuild Illinois grant funding. Which means all of the people of Illinois have an investment in the success of the SIH Cancer Institute, and I couldn't be prouder of that. We aren't stopping there. As of today, the SIH Cancer Institute's cafe serves meals to more than 300 patients and 120 employees every day. Well, that number of patients and staff is bound to increase with this latest expansion. So we're granting SIH an additional $150,000 to build out the cafe, ensuring that every patient has a nutrient-rich meal that they need to fuel their bodies while they're undergoing treatment or while treating patients. And earlier this week, we yet again approved another grant for $150,000 to renovate the kitchen and the prep space here. So there's nothing about this place that we don't want to support, and we're going to continue to do that. And once again, the idea of the state of Illinois being invested in excellence is something that I think we should all be very proud of. Each of these expansion projects speak to what our state's infrastructure program, Rebuild Illinois, is all about. It's about our people. It's about serving people. It's not about things. It's about people living their lives better. It's not about roads and bridges and broadband and buildings, though that's what we're doing. It's about addressing the needs of families in every community so they have access to the facilities to improve their lives. It's about making sure that we have the modernized infrastructure that is so important for the facilities, the equipment that our residents require, whether they're driving on I-64, not hitting a pothole, or visiting friends on the various roads around the region that we've rebuilt and repaired, or battling a life-threatening disease. To the entire SIH cancer treatment team, you are setting the highest standards for care and treatment. It's a challenging endeavor, I know, but every day you exemplify what it means to provide empathic patient care. It's nothing short of heroic. We're all so proud of it, and I thank you all for your service in that endeavor. And to the patients that are here today, you are fighters. You are resilient and relentless, an example to us all. And when you ring the bell, know that you will have 13 million Illinoisans celebrating alongside you. So I ask everyone in this room to give a big round of applause to all of our patients and all of their caregivers. So before I wrap up, I'd like to just take one moment to say a few words about our dear friend Ed Smith. He was a fierce advocate for our investment in this institution. And as I stand here today, I can't help but think about how proud he would be of all of you, of all of us, of the state of Illinois. And I can't help but think how much I wish he were here to celebrate with us. May his memory be a blessing to us all, and it is. So thank you, and with that, I'd like to turn it over to a friend, someone that I get to work in a bipartisan fashion with to lift up all of Southern Illinois, and that's our great Senator Dale Fowler. Dale?
Thank you, Governor, and good morning, everyone. Another beautiful day in Southern Illinois, huh? Isn't it great? So honored to be with you. Thank you, Governor. I really appreciate the introduction and your words. And thank you once again, Governor, and your administration for the continued commitment and investment in hope and prosperity of Southern Illinois. Southern Illinois, the heartland of America, right here. We are witnessing growth in areas such as manufacturing, our amazing 20-plus state parks, roads and bridges, rivers, education such as K-12 schools, community colleges, SIU, and of course, investment in healthcare, which is why we are here today. An investment in Southern Illinois that is and will continue to generate great paying jobs, along with millions of dollars in direct and indirect economic impact to our region. But today is about highlighting a pivotal time in the collective pursuit of a world free from the shadows of cancer. The expansion of this Cancer Research Center heralds a transformative era in healthcare accessibility. No longer will cancer patients face the burden and the stress of traveling to other states for care. This state-of-the-art facility is a beacon of hope, ensuring that cutting-edge treatments and compassionate care are readily available within the entire region. This investment is bringing healing closer to home, reducing the hardships faced by patients and families on their journey to recovery, redefining the landscape of cancer care, and create a haven where hope, innovation, and personalized treatment converge for the benefit of all those affected by this formidable challenge. But most importantly, this expansion is unquestionably about saving lives. Thank you to SIH and to all the healthcare workers that come to work each and every day, and for your passion to serve others. God bless you all. Thank you very much. This time, it's an honor to introduce Dr. Papazzi.
Good morning to this beautiful day in Southern Illinois. Thanks to Honorable Governor Pritzker for allowing us to host this opportunity. I would start off by my thanks to the SIH leadership, who has allowed me to be a part of this amazing journey. It has been hallmarked by rapid growth and often overlooked healthcare needs in underserved areas. Looking back to March 2015, I think we have had humble estimates of growth. Initially, we had estimates of only 3 medical oncologists in this place. Our estimates quickly revising to 7, and now currently we think we need 9. Hence, we require the expansion of this facility. As the rest of the country, we have been facing physician shortages amidst a nationwide shortage, and we continue to see major challenges in this space. Despite the challenges of rapid growth, we have been committed to deliver high-quality care to our patients. And this has only been possible with an intense collaboration between our medical oncology team, radiation oncologist, surgical specialist, and our amazing staff, above all. I would like to thank Dr. Marsha Ryan and Dr. Mary Rosenau, who has initiated this initiative and whose efforts had made this possible, that we gather here together multiple times a week for our specialty tumor boards. That allows all of our medical, surgical, allied specialties, and all the support staff to collectively devise management plans for our challenging cases. Some of the services that I would like to mention here include stereotactic radiation therapy by our wonderful radiation oncology colleagues, IR team that have been able to offer radioablative therapies, and especially Dr. Shankar, who has successfully managed a surgical oncology program. And I would specifically mention the HIPEC program that he initiated here and has been successfully running it. One major challenge then when we started and we faced was the lack of trained professionals, especially nursing staff. Over a period of time, we have been able to overcome this by our internal nursing education program. Today, most of our nurses are OCN certified, or they are going to be very soon. I bet Susie O'Neill will highlight it further. In terms of teaching, we have also started collaboration with SIU School of Medicine, especially Lincoln Scholar Program, that we will be able to offer 100% of their clinical rotations within Carbondale area over a 4-year period of time. It is also essential to acknowledge the significant stride we have made in clinical trials arena. It comes as a surprise to many of us, clinical trials not being synonymous with community care, especially in rural communities. As part of our COC accreditation, that's Commission on Cancer, we are required to enroll 4% of our analytical cases every year in clinical trials. Just 7 years ago, we were able to meet the requirement by relying upon other partners, Siteman, SIU, and other places. But as of year 2023, we have been able to accomplish enrollment all through our internally available clinical trials. And this year, we're taking it a step further by partnering with Tempus Labs. And that will open the door for at least 60+ industry-sponsored trials in our area. Finally, the word cancer program is not justified unless we talk about what happens beyond these walls. And the amazing work that has been performed by Angie Bailey and her team. We believe the best way to fight cancer is not to let it happen or to catch it early. Our breast cancer screening program, lung cancer screening program, and smoking cessation programs are all part of our effort to reach out to community to affect population behaviors and downstaging the disease. In the end, I would like to remind everybody that hope is home, and we are committed to providing best possible care to our communities. As you will walk through our corridors here, you will see a lot of artwork, and everything has been contributed by the community and a lot by our patients. To this note, I will hand it over to Lori Fink, and she has been a wonderful advocate for us. Thank you very much.
Good morning.
Good morning.
It's really great to be here. And it's really great to be here. I appreciate the invitation to share some of my experience both as a patient, one of those 300 people who come through the doors every day. Luckily, I only have to come every 6 months now, and I'm totally fine with that. But in June of 2018, I retired after a 30-year career at Southern Illinois University. And retirement was this vast horizon full of possibility. 3 months later, I was diagnosed with a rare and aggressive form of inflammatory breast cancer, triple-negative breast cancer, stage 3B. So I was now a card-carrying member of the club no one asks to join. Like anyone who receives a diagnosis, I went through the dark night of the soul, and actually for me it was more like a dark week of the soul. In existential crisis, the internet was not my friend at that point in time. There was a lot of fear and rage and sadness. But 3 critical things created a shift for me. Number 1, my scans were clean, which was the first shred of good news that I could hang on to. 2, a book literally fell off the shelf in my office downstairs, and it was entitled, Your Body Believes Every Word You Say. And I dove back into that book. I'd read it 10, 15 years before, but I dove back into it, as you might imagine, with a renewed, different passion and focus. And then thirdly, I came across this quote, and I can't remember the context now, by James Cameron, that said, hope is not a strategy, luck is not a factor, fear is not an option. So boom, I had a way to move forward, and I realized my mind would be my greatest ally in the healing process. Despite the internet prognosis, I made a clear decision not to heed the statistics, which, believe me, were very bleak. And I decided to proceed on my own healing path. I told my husband I'm going to be okay. Anger and sadness and most of the fear fell away. Sharing a few examples of how I chose to make my mind my ally, rather than asking myself, why is this happening to me, I asked myself, why was this happening for me? This removed any sense of victimization and powerlessness that I was feeling, and the answer was this. It was like a Disney Fast Pass. Congratulations, you are moving to the front of the line of your life for the very first time, and it's going to be all about you instead of putting others first. I never said I had cancer. I still don't. I say there are cancer cells in my body that are not welcome and will be eliminated. I renamed this place the Healing Institute. If you look on my cell phone, that's how it shows up in the contacts. That's how my friends and family have been referring to it ever since. Some folks would say, oh, I'm so sorry when learning of the diagnosis, and I said, please don't be sorry. Instead of being sorry, I want you to flip that energy into healing vibes and energy for me. So I met with Dr. Farah, who outlined a treatment plan which included 18 rounds of dose-dense chemotherapy, including a form of chemo called the Red Devil, woof, a mastectomy, and 33 rounds of radiation. He encouraged me to seek a second opinion at Siteman in St. Louis, and I did. Siteman recommended the exact same treatment plan. So why would I drive 2 hours each way once a week for chemo and every day for 33 days for radiation when I could receive the same quality care in my own backyard? So I felt very confident in my choice to stay local. Wanting to be an active participant in my healing, I created my own medicine bag of sorts. It was full of love, prayers, and support from friends, family, former students, and even strangers. I made a healing book, began practicing Qigong, made a Pinterest board. If anybody's on Pinterest, you can find this. It's called Survive and Thrive, with a sub-board that said, chemo ain't no thang. I listened to meditations. There were gifts from friends, talismans, rosaries, so many cards, socks. I wrote a thank you letter to my right breast before surgery, made a playlist of songs that kept me in high spirits, and I plastered healing affirmations on sticky notes everywhere in my house. In fact, there's still one from 2018 that says, win today. Throughout treatment, I was surrounded by caring professionals here at the Healing Institute. Each engendered a deep sense of optimism and ultimately trust. They were so very attentive and present. I wasn't just a number, which I would think would be hard to do with a club with so many members. No nausea, no diarrhea, no mouth sores, no pain, no loss of appetite, not much fatigue. Of course, I lost my hair and rocked the G.I. Jane look for a little bit. I was able to maintain all my physical activities, and there was only a tiny micrometastasis after surgery and radiation. So 6 months of oral chemo was prescribed to what I call seal the deal. Again, mind as ally. Dr. Poppelzai, I would like to thank you for taking me on as your patient late in the game. I always felt like a human being, as if you have all the time in the world. I feel seen and heard, and that is the sweetest and highest form of medicine. I am grateful to you, the entire staff here at the Healing Institute, and again, I'm very, very grateful to still be here. Thank you.
Thank you, Lori. Hi, I'm Susie O'Neill, the System Oncology Clinical Service Line Director. And I want to start by thanking all of you for joining us at this wonderful event today, and especially thank Governor Pritzker for your generous support of our SIH Cancer Institute. I'm a registered nurse and have spent most of the last 38 years of my career in oncology, primarily in large urban areas and academic medical centers. I have been part of the SIH oncology team for the past 5 years, and I'm really proud to say that the care that our patients receive here in rural Southern Illinois is right up there with those urban and academic medical centers, and it's close to home. Our patients don't have to drive to get far distances to get there. A lot of thought was given to the location of the Cancer Institute. It's beautiful here, isn't it? It's nestled next to the Crab Orchard Wildlife Refuge, and during infusion treatments, our patients can look out over the beautiful landscape of the pond and the wildlife refuge. The interiors were designed with a tranquil feel because, let's face it, cancer is really stressful, and we wanted to create a more calming environment. And Dr. Poppelzai referred to the artwork. With our expansion, 52 pieces of artwork were commissioned from local artists, and many of those are our patients, our former patients. The Cancer Institute is an accredited comprehensive community cancer program through the American College of Surgeons Commission on Cancer. This accreditation provides a framework to deliver high quality of care, and it benchmarks our quality data nationally, and it demonstrates the high quality of care provided to our patients. In 2023, Memorial Hospital in Carbondale was awarded the American College of Surgeons Surgical Quality Partner Diamond Award for providing high-quality surgical care to our cancer patients. Additionally, in 2023, the Radiation Oncology team received the distinguished American Society of Radiation Oncology APEX accreditation, which exemplifies their commitment to safety and quality. Here at the SIH Cancer Institute, we provide a seamless experience for our patients like Lori, with lab, medical oncology, surgical oncology, radiation oncology, palliative care, rehab services, a state-of-the-art pharmacy, and infusion, right here on site under this roof. Similarly to the academic medical centers like Siteman, our treatment plans follow the gold standard National Comprehensive Cancer Network guidelines, and patients have access to participating in clinical research trials. Our nurses are actively engaged in seeking out best practices by reviewing current literature through evidence-based practice. And as a matter of fact, 3 of our nurses are presenting their work at a national oncology conference this spring. 3 nurses from rural Southern Illinois sharing their best practice. In addition, we have many ancillary services available for our patients to support them on their journey. We have an oncology dietitian, a chaplain, and a social worker. Each patient has a nurse and a financial navigator to assist them on their journey, mitigating barriers to care. A cancer diagnosis and treatment can be emotionally and financially devastating to a patient and their families. In 2022, the financial navigators helped facilitate $2.7 million in financial assistance for our patients. Our focus on providing excellent quality patient care for the people of our community. I want to thank you again for all of your support and introduce Woody Thorne.
Thank you very much. Governor, thank you. Thank you very much for coming today. Thank you for your patience in this team telling the important story of what happens under these roofs. At SIH, our number one commitment has always been and continues to be the caring of our patients and the families we're privileged to serve. The critical need for expanding our Cancer Institute is not only an honor to honor that commitment, but a moral obligation of a paramount importance to do everything we can for our patients facing a diagnosis of cancer. The SIH Cancer Institute has been an answer to an unmet need, has been referenced in Southern Illinois to bring cutting-edge technology treatment and team-based coordination of care to each patient without having to travel away from their families and their homes. And our dedicated staff and our network of care providers know that every person's well-being is deeply connected to the health and wellness of the community. Their behaviors align with the SIH mission, vision, and values that are the foundation of our organization, guiding us to create a culture unified by our commitment to care. Much of what we do could not be accomplished without the support of community partners, funders, and our elected officials who believe in our mission. Collaboration with others makes our responses to the needs of this region more informed and consequently more effective. Partnerships also expand our ability to consider the entire continuum of healthcare needs as well as the social drivers of health that influence our responses to these needs. Knowing that you, Governor Pritzker, also believe this to be the case, we're fortunate to be represented by our region's legislators who appreciate the power of collaboration. To go far, we must work together. And I speak for SIH when I say we are humbled by the support we have received that made this project possible. Beyond yourself, Governor Pritzker, there are many within our organization and others who have worked behind the scenes to bring this about. Too many to name, but for all who have helped make this possible, we'd like to sincerely say how much we appreciate you. Beyond the support being announced today by you, Governor, we've seen Southern Illinoisans helping one another through the diagnosis of cancer in their lives, something that could happen to any of us. Extended families, children in our region's schools, congregations, and parishes, volunteers, the business community, and our staff and patients have all banded together to raise funds to help make this addition a reality. The foundation, the SIH Foundation, has been grateful for the chance to steward philanthropic gifts targeted to the patients and programs here at the Cancer Institute to change the way that cancer is delivered close to home. Through the capital campaigns and ongoing patient and community support funds, we've been able to direct more than $7.5 million towards the advancement of our capital expansion efforts as well as these patient health-related social needs. This is done through our foundation's patient assistance funds in the form of access to fuel, transportation, prescription medications, medical expenses, and needed household expenses, all with the goal of improving outcomes and equity for our patients. For all who share our vision of creating a healthy Southern Illinois, we're committed to this work, making this vision a reality. We thank you very much, and we look forward to the work ahead in treating our patients. Now invite the media for any questions and invite Governor Pritzker to answer any of those questions. Thank you very, very much.
You sure you don't want to take the questions? Any questions, members of the media? Yes.
Governor Pritzker, how easy of a decision dollars down here where, you have patients that don't have to drive to St. Louis, Nashville, and they can stay here locally and get the good care that they deserve.
Well, you just described some of the many reasons why it was somewhat easy. It's always challenging, obviously. Significant resources going everywhere in the state is important to me, but we also are, trying to manage resources as best we can. But this is one of the best investments you can make. Just period, end of sentence. We're talking about healthcare in a region that needs investment in healthcare. We're talking about a center, and I said it earlier, a center of excellence. And so the idea that we're, putting money into this as opposed to some things that may be fleeting and have only a minimal and short-term effect, these are the kinds of things that I think we all think are the right things for government to be involved in. Not today, because I just met up with these folks as I walked in the door, but I have toured the facility before, and I've seen pictures of the new, the additional space. I'm just so thrilled. I think that the patients who walk through the door here for the first time are blown away. I was blown away, so I can only imagine when you think about, the quality of the healthcare that you're going to get here and the survival rate and the quality of the doctors and nurses and all the healthcare professionals here, it kind of comes through in the way this place looks. This looks like what it is, which is a modern place for, I love your description, for healing, So, yeah, but it's terrific. Yeah.
After seeing and hearing some of the stories today, what is motivating you to go forward?
Well, I know that that after this, that no one's, Woody in particular, but John and everybody else here, nobody's going to stop asking for more resources for this facility. And I think all of us believe that, again, these are the investments that we ought to be making. So, so I have to say, it reinforces the good work that's being done here, and the good work that I think the people of Illinois, are confident about in the investment that we've made.
I'm going to offer one
Yeah,
thing.
John,
Something Dr. Papazai said, and it may not have registered for everybody. The research, the clinical trials that he talked about, and the number of people that we're able to keep here for clinical trials now, that number